Well, hello, friends, and welcome to another WSIB Truth Matters with Joe Machado, where I separate the truth from bullshit, facts from fiction, in plain English. Today, I'm going to talk about a matter that I've been following for a couple of years now, and it's a matter of great concern for me, as I know it is for a lot of people throughout this province, both medical professionals, legal professionals, and more importantly, injured and ill workers, the ones that are being affected by this problem in a significant way. I've put a lot of thought into it, and I've got a plan that I have been working for at least the last couple of years. And I think today we're going to implement phase 2 of that plan. All right, my friends, so without any further delay, let's get at it. Well, my friends, and we're back. So today's topic deals with mental health, which is a problem. It is a significant problem, not only among injured workers and ill workers and their families, but it affects a lot of people, not only throughout this province, but pretty much all of Canada. I hear back from people who watch my channel from as far as Newfoundland and BC and the West Coast. They share a lot of the same concerns that we do here in Ontario as far as the workers' compensation system, whether or not it's failing them. They hear me talk about my own views, my opinions based on over 30 years of experience dealing with the WSIB in Ontario and the many experiences that I've had over the last 30 plus years, both personally as well as with clients as well. And they number in the thousands. And the concerns that people share with me are serious. There are many facets of the system that aren't working. Particularly here in Ontario with the Workplace Safety and Insurance Board. They have gone so far in the opposite end of what they were supposed to be doing when the system was set up back in 1914. Sir William Meredith had several principles on which the system was set up on. Nothing today resembles any of what he suggested. They were good, solid principles based on research, based on experience. But over the years, politicians have managed to completely do away with it, and these charlatans that they put in leading the WSIB over the last few decades, and I've become familiar with some of them. The whole system has become a joke, and a system that people are supposed to depend on. People depend on to this day. They can't trust it. They can't trust that it's going to provide them with the support that they need for themselves, for their families, to recovery from their illnesses or disease or injuries, to get back to work, to a productive living. And for as bad as that is, and you've heard me talk about many, many situations on this channel over the last couple of years and over 170 videos. And there are lots more to come. Today, I'm going to talk about the issue of mental health. I've been watching it very closely for a couple of years now. And as the WSIB Settlements Network has grown throughout the province, from Thunder Bay to Ottawa, Windsor, Fort Erie, and everywhere in between, I have a bird's eye view of what's actually taking place. I get a glimpse of what's happening within the WSIB. Perhaps a glimpse that not most people have. There are lawyers and paralegals that deal with the WSIB, and they're mostly advocating for injured workers within their own communities or city. And they're not necessarily aware of what's going on throughout the province because their client base just doesn't expand that way. But when I operated my paralegal firm, we had expanded all over the province with over 10,000 clients. So we had a really good indication as to what was happening, not only at the WSIB head office at 200 Front Street in Toronto, but other offices, because they do have other regional offices that handle cases within those communities and surrounding areas. And they have their infrastructure of case managers and directors and managers and support staff in these other offices. Well, unless you have cases that are being managed through those offices, you're only going to have a view of what's happening in one particular area. To be able to get a better understanding of what's happening across the board, it is very difficult, unless, well, it's actually impossible, unless you deal with it, because anything you hear is hearsay. If you're not dealing with individuals within those communities with injuries that sometimes are more predominant in those communities, like, for example, mining in Northern Ontario, you're really not going to see how things are handled in that area. And so from my vantage point, I get to see all of it. And I get to see the inconsistencies of how policies are implemented, if at all. How cases are being adjudicated. Are they being done on a consistent basis or in a consistent manner? Is a set of policies that should apply to all within those particular circumstances? Is it being applied consistently? Is it being applied on a one-off? Well, from my vantage point, from what I've seen, no. There is such a lack of consistency on how policies are implemented, how cases are being decided on by these case managers and eligibility adjudicators, that it is mind-blowing, to say the least. I can't use another word to emphasize that. Actually, I can. It's fucked, is what it is. In the area of mental health, cases that are dealt with under the WSIB's psychotraumatic disability policy, and even under the chronic pain disability policy, because a lot of people that fall within the 5-point criteria to be able to fit within the writing of the chronic pain policy, oftentimes there is a need to receive psychological treatment in one form or another. But a lot of the cases I'm going to talk about today deal with the psychotraumatic disability. Cases of chronic mental health and cases of post-traumatic stress syndrome, PTSD, which is prevalent in a lot of the individuals that fall under the exemption of first responders, or the presumption for first responders. And there's a very specific policy that addresses that. These are individuals that are involved in policing, ambulance drivers, emergency workers, firefighters, individuals who are predominantly that fall within that policy. And they get to see a lot. These people get to experience a lot that most of us will never have to see or experience. And I'm talking some really, really difficult situations involving death, where they may have or didn't have the opportunity to help someone in need. And those are the things that you can see and then you can't unsee. They stick with you. And they inevitably have a significant impact on some of these individuals who fall under the first responders policy. And basically, the first responders policy essentially, in very few words, means that if you are considered a first responder and you file for a claim, then it is automatically presumed that your condition is as a result of your work, so that immediate treatment can be provided without delay. Most of the treatment is psychological in nature. And of course, your other benefits like loss of earnings benefits, if applicable. But healthcare is important. And 1 day delayed in providing treatment for somebody suffering from post-traumatic stress is different than 1 day delayed for someone who has a broken leg, is in a cast, and obviously there's a certain level of pain and restrictions and all of those things, but the acute phase isn't as significant as someone who needs to have some psychological treatment now, not tomorrow, or 1 week from now, or 3 fucking weeks from now, or 3 months from now, or a year from now. And I have seen firsthand the delays in all of these, not just a day and a week or a month, but far more. Here's what I see as a significant problem from speaking with a lot of individuals who have claims that are being handled under the psychotraumatic disability policy, who for post-traumatic stress disability or mental stress. And I get the feedback. I've also gotten the feedback from healthcare professionals involved in treating these individuals, psychiatrists, psychologists. I get to see it. I get to hear from them. I get to hear how they're bullied and being forced to return to work when their doctors are saying no. Being forced to go back into the situation, a trigger that immediately places them back in a situation that caused them to suffer from PTSD to begin with. You know, I've seen how the WSIB denies or limits entitlement for treatment. I see how you have these case managers overruling a therapist in terms of the treatment that should be provided, the amount of treatment that should be provided, recommendations by therapists, even their own specialty clinic, their mental health specialty program, where people are being referred to by case managers at the WSIB, who then turn around and pick and choose whatever they want from a report and recommendations provided by psychiatrists and psychologists to manipulate somebody into trying or pushing them going back to work when they're being told that it is counterproductive, that it shouldn't be pursued at the moment. I'm being told how people are in an acute phase requiring treatment, and they're waiting endlessly for the WSIB to approve it, only to have a case manager turn around and deny entitlement. I have a particular case where this person, because this person was pleading for help, the mental health specialty program recommended treatment for this person. This person was in an acute phase, and the case manager denied it. And this person went on to suffer unimaginable losses and difficulties, including being beaten up by police officers who thought that this person was trying to be disruptive. But this person was crying for help. And it took some very strongly worded letters that went up as far as the director to have the person reassessed with a specialty clinic, basically repeated what they had said many, many months earlier, after the irreparable damage had already been done, recommending that this person needed treatment. And finally they said, okay, I guess we fucked up. But they can never repay the amount of anguish, damage, and pain that this person was subjected to because of the WSIB's neglect to do the right thing when they should have. And yes, WSIB, that's what I'm saying. In my opinion, the neglect. If you have a fucking problem with that, you know where I am. You always do. But I call it like it is. This is what you did. And I have the paper trail and the documentation to prove it. Every single part of it, including the pictures that she sent me when she left the police station, when she was finally released with gashes in her forehead and she was still bleeding. Yes, those. I have all of it. Issues with where case managers are asked in a respectful manner by the worker to please communicate with them in writing so that they can understand what's being requested, so that they have time to think about it, so that they have enough time to get some advice or counsel, so that they're not saying you're doing the wrong thing, because they always have to feel like they are under that microscope. To communicate in writing, where case managers disregard that, managers disregard that, directors disregard that, and insist on calling the person despite their repeated requests. This is a form of intimidation. This is a form of just the sleazy, underhanded tactics that these people employ to bully people who need help. And then when all else fails, they threaten to reduce or stop your benefits. The one thing that you depend on to support yourself and your family. They threaten to reduce or stop your benefits. And unless you bend to their will, and oftentimes are forced to go against your own doctor's advice, otherwise, that is what happens. And I have seen it happen where they followed through with it. These people. There's no humanity or compassion from these people. They don't give a shit about you. They don't give a shit about doing what's right when it's called for. They don't even give a shit about their laws and following their laws and their own policies. They circumvent those when they want, at will. They don't care. It's all to save a buck, to give it to employers. I'm not going to talk about that today. You know how I feel about it. So my friends, in order to combat this, because I don't think that injured workers can depend on politicians or rely on them, because politicians have been aware of this for a long time. And in my opinion, have done nothing to fix it. And injured workers can't do it themselves and take it upon themselves to fight this fight. And it is a big fight that requires a lot of support, a lot of expertise, and a lot of resources. But you know what, my friends? I'm going to take up the fight for you. I'm going to take up the fight. I have been putting this together for, as I said, 2 years now. It's a plan that has been meticulously put in place. And a plan that was only possible today as a result of what I launched, WSIB Settlements, a little over 2 weeks ago, which is our preferred legal provider program, to provide injured workers with expert, experienced legal counsel and representation throughout the province. Lawyers and paralegals who are the best at what they do to help fight their individual causes and deal with appeals. That was launched. The response has been tremendous, as I knew it would be, because the need is too huge. And now, as a result of having done that, I am now forming a special action team made up of lawyers and healthcare professionals dealing with the WSIB, specifically dealing with psychotraumatic disability, PTSD, and mental health issues. And this team has basically two very important and two very clear objectives. One, to fight back against the WSIB's punitive tactics towards workers suffering from mental health problems, so that workers have the adequate legal support and medical expertise to be able to fight back and push back when they're being threatened and bullied by the WSIB. That's one of the objectives. The other one is to develop a legal framework, again, made up of lawyers and psychologists and psychiatrists, to determine the WSIB's liability for the way that workers who require mental health treatment are being treated, and to determine personal liability for decision makers making decisions that are not medically based, that are not within the law, to deny workers under chronic pain disability, under psychotraumatic disability, treatment, or to limit treatment. These are the two clear mandates. And where is this headed? Well, the WSIB's never been challenged in the courts in terms of liability. And yes, I know that they all feel that they have this blanket protection given to them by the Workplace Safety and Insurance Act from doing some of the most horrible fucking things that if healthcare professionals treating these people did, would probably end up in jail or sued for violating their responsibilities, their duty of care to their patients. These individuals at the WSIB believe that for all of their bad actions, that they're shielded from legal liability, from being held accountable. Well, I'm prepared to put that to the test. There are certain cases that have gone through the courts recently, and the courts were receptive to them. We just need to be able to demonstrate that this has become a somewhat of an epidemic within this system, where there has been a continuous systemic abuse of injured workers' rights as granted within the Workplace Safety and Insurance Act, which I'm going to cover in a moment. To determine, we've set up a criteria. So what we're doing is we have a questionnaire that you can go on with WSIB settlements, and you can register. It's free. The registration link will be in the description of this video. There's no obligation. The criteria is if your case manager, and I'm going to put it up here, if your case manager denied treatment for an accepted claim for psychotraumatic disability without having had a medical opinion with which to support denying that treatment, that's one part of the criteria. The other one is if your case manager decided that there were no medical restrictions assigned to your psychotraumatic disability. Even though your psychologist or your psychiatrist is stating in a medical report that no return to work activities should be done at that time. And if case managers are going against that, to reduce your benefits, to deem you uncooperative, to stop your benefits, that's the second part of that criteria. And the third one is, your case manager decided that you reached maximum medical recovery, even though your psychiatrist or your psychologist is still recommending more treatment. Because they believe that when they make a determination that you've reached maximum medical recovery, they can now manipulate the system to try and push you back to work when you're not ready and your doctors are saying you're not ready to go. But this is what they're doing. The WSIB set up a community mental health program, which they refer to as their community mental health clinics throughout the province. You probably have heard of it. It's called Altum. There's a mandatory requirement to get approved to a clinic or for an assessment. And so I'm going to put the link also in the description so you can read it for yourself, but I'm also going to put it up here. So the WSIB intake mandatory requirements are a registered WSIB claim. Okay, that goes without saying. The next one is that the psychologist calls the WSIB to inform and obtain authorization or an approval letter for assessment only or assessment and treatment. So there should be an approval letter for that. The third one, which is a critical one that I want to really emphasize, is that a WSIB case manager reviews the claim to determine if the injured worker or the injured or ill person is eligible for the community mental health program. The case manager is going to determine that. Based on what qualifications? Case managers aren't doctors. They haven't gone through years and years of medical school to make these recommendations. Why are they in charge of making these eligibility decisions? Why are they not accepting the report, the recommendations provided by the clinic, by professionals and specialists at face value and accept them for what they are? The expert opinion that they requested and have paid for. But, I guess they figure that since they pay for it, they get to decide if you get it, or if you do get it, how much you get. Doesn't that seem fucking asinine? Right? So, here's the section of the law that they seem to be relying on when they're making these asinine decisions. And again, the level of liability has not yet been tested as far as they're concerned. So here's what the law states. Section 33, subsection 1 of the Workplace Safety and Insurance Act specifically. This is what it states. The Workplace Safety and Insurance Act provides a worker is entitled to benefits under the insurance plan and is entitled to such health care as may be, now get this, may be necessary, appropriate, and sufficient. Okay, let me repeat it. As may be necessary, appropriate, and sufficient. So, in other words, a case manager who has zero medical training whatsoever and has no business making decisions regarding whether somebody should be receiving treatment is making those decisions. So, suppose you're sick, not in a sense of this policy in psychotraumatic disability, but suppose you fell and you broke your ankle. You go to the doctor. That's the natural thing that you do, right? You get assessed by your doctor. Your doctor does some tests, makes an assessment. Then your doctor recommends treatment. Your doctor recommends the necessary, appropriate, and sufficient treatment for your ankle to heal properly, right? That would be within the doctor's purview, as I think everybody living on this planet and in the reality that most of us live in, that's what happens, right? Even these people who work for the WSIB, because they are susceptible to being injured or to being sick, where they require going to the doctor. Everybody does, right? Right? So you trust your doctor, these recommendations are made, yada, yada, yada. But what if your doctor does something, a particular type of treatment that isn't effective, that could actually cause you to have a significant limp and pain from that injury, which in most cases, if handled properly, would have healed and you would have gone on with the rest of your life. But supposing there's a decision made by the doctor, whether it be intentional or not. I believe that most doctors are very diligent in making sure that their patient is treated properly. And if they don't have the expertise to do certain things, that they know well enough to refer them to a specialist, right? This is what happens in the real world, to ensure that you get the best possible treatment and the doctor is doing his duty of care. But what would happen if something went terribly wrong? Well, the doctor could be sued. That's why doctors have liability insurance, because they know that they could be sued. And there's another thing, right? That's their rules of professional conduct, which, if you look at the College of Physicians and Surgeons and you go on their website, rules of professional conduct for doctors are quite extensive to keep them in line, to make sure that doctors are doing the absolute best that they can for their patients. I'm just going to read for you one of the policies under the College of Physicians and Surgeons of Ontario, talking about professional behavior under the section of advocacy. And under advocacy, doctors are to provide advocacy for patients and improved healthcare system is an important component of the physician's role. And while it may sometimes lead to disagreement or conflict with others, physicians must meet the expectations for professional behavior, even in these contexts. Professional behavior to their patient. Because there are serious repercussions if they don't. So, on the one side of the scale, you have healthcare professionals who have been authorized within the Workplace Safety and Insurance Act to provide treatment and care to injured and ill workers. They have a significant level of scrutiny. They have a significant level of liability exposure if they don't follow the strenuous levels and policies within the College of Physicians and Surgeons to ensure that they are following those policies in terms of ensuring that they're providing the best possible care to their patients. Otherwise, something very significant can happen, which could result in them losing their license, right? Or having significant sanctions placed on them or limitations on their license, even to the point where they could be sued in a court of law, right? Then you have these case managers who have no fucking experience or expertise or medical training, making decisions about your health, about the quantity of treatment that you receive, about whether or not you should receive any treatment, which is also authorized under the Workplace Safety and Insurance Act, Section 33, subsection 1, as I just put on the screen here a few moments ago, right? That's all they have. Do they have any liability? Are they disciplined for any of these actions when they make these decisions that have some serious repercussions, like death? Are they held accountable? Or does somebody just say, whatever. I'm going to go about my old merry life and not even give it another thought. Because from my vantage point, if they were held to a high standard and taken away from the business of making medical decisions, and they had to face the similar level of liability that doctors are faced with when they're treating a patient, do you think that the system would work a little better? Do you think that workers would be given an opportunity to recover before they're manipulated and trying to go into a job that's only going to further deepen their level of psychological distress that they're in? Do you think that they'd be threatening a worker to cooperate with them and go against what their doctors are saying? Do you think they'd get away with that? Friends, it needs to stop. It needs to stop. And so, I'm going to give you the best tool, and I did a video on this, but I'm going to give you the best tool that anybody could ever give you. And this is something that you can do yourself. If you don't find the need to get professional help to support you and help you with your claim, whether it be my firm or any other company, this is something you can do, because this is a powerful tool, but it has to be used. And that's the WSIB's responsibility to what is required when communicating decisions to a worker. It's covered under policy 110102. I'm going to put it up on the screen so you can write it down or go back and refer to this video, whatever you need to do, because this is an important policy. Because there's nothing more significant that you can do for yourself but to use the tools that they've created to further to fight for your rights. If you want to do it alone, you need to have this. This will serve you well, because even if some idiot at the operating level or his manager or director decide that they want to ignore everything that you've asked them to do, which is a requirement under their fucking policy, then you have something so that when you get to the tribunal and you have a person who actually believes in the law and following the law is going to review it and say, no, you were stonewalled because they didn't do what they're supposed to. So here's the policy: communicating decisions. For loss of earnings claims, the decision maker communicates the decision either by issuing a form letter or by writing a decision letter, which is the same. In either case, letters sent to a worker are copied to the employer and vice versa, so everybody's in the know. And the decision letter must contain these 4 points. It has to state the decision. All right? Here's very simple. I'm denying entitlement to healthcare treatment. I'm making that decision. Okay, I've stated the decision. But the next one says that a decision maker must explain the rationale, including any applicable policies to deny the treatment. So I'm denying the treatment because I reviewed what your doctor is saying, that you require additional treatment, but I don't believe that you actually require additional treatment. And I believe that policy or section 33 of the Workplace Safety and Insurance Act gives me the authority to make that determination. Okay, number 3, it outlines the information used to make the decision. All right. So you are relying on my doctor's recommendation to deny treatment. Even though my doctor, who's a healthcare professional, authorized under the provinces of Ontario, regulated under the College of Physicians and Surgeons, with extensive training in his area or her area of expertise, I don't believe that they're right. You don't. That's the information that I use. Well, then you can go back at them and say, well, but there were 2 other doctors who said differently. Or there was another doctor with more expertise who actually assessed me and took a detailed history of my condition, how it started, what treatment I've had, whether it's worked or hasn't worked. And the reasons are laid out for recommending additional treatment. So you decided to ignore that. So you have to explain why you preferred this opinion as opposed to this one. But believe me, in most cases, they don't have any opinion to provide or go against. Because in most cases, they're not challenged. And then they have to advise you of your right to appeal. So it's 4, the last one is easy, but there's 3 aspects of the information that's required on a decision letter that you can use so that somebody of sane mind who actually knows what they're doing can look and scrutinize that letter and say, this person was totally out to lunch. They don't have the expertise to overrule this opinion. They don't have another opinion. They just decided that they're going to deny it and pull a few words from some obscure memo that may or may not be outdated as far as the condition is concerned and whether or not that treatment was overruled by the WSIB that previous time by some other schmuck who decided to overrule my doctor at that time as well. Because my friends, if you force them to provide this information, because there isn't, if challenged, there isn't a case manager or director who could force you to try and move ahead with an appeal without you understanding the basis for that decision and why it was decided and why the proper section of the act or policy was used, why certain information was ignored, all of these things. You have a right to know those things. And those are the things that they don't like to do, because every time that they commit pen to paper, particularly when they have to sign it, then they own it. They own that document. They own the opinion that they provided. And therefore, they may be exposed to liability. But they don't like that. They never liked that when I did it. Right? Because they're cowards. But use this section of the law effectively. Right? Because eventually, if your case ends up, if they continue to insist on ignoring objective evidence, ignoring their own law, the tribunal will look at it and say, no, it's going back. And by the way, I've done extensive tribunal reviews over the past couple of years just to see how bad things are and how often the tribunal sends it back to them. And they do that a lot. Why? Because they're getting bullshit decisions made by idiots who have no business making those decisions. In my experience, and they always know where to find me if they have a problem with my description and my accounting of what I see and my observations. Friends, this isn't going to bring about change overnight. I know that. I've been dealing with this organization for over 30 years. I know that. But you got to start somewhere. And I can tell you this. They're not prepared for this. They're not prepared to be challenged. Just like they were prepared when I launched the Preferred Paralegal Network. Because they're going to have more lawyers, more paralegals coming at them. And they're going to come at them from everywhere. And yes, it'll take a little bit of time, but by this time next year, we'll have over 500 paralegals and lawyers on that network from every corner of the province. The WSIB won't know what the hell hit them. Same thing with this policy. We will, or this team, we will build. We can address issues that are taking place now. For those of you who want to explore that, and we're creating a framework to ensure that this kind of nonsense stops. Because it needs to stop, my friends. As always, it's been a pleasure imparting this information. I know some will take it at face value and use it well, and it will give them something to build on. Others are probably just going to, whatever. That's fine too. At the end of the day, my goal is to make a difference, to help injured workers have the treatment that you deserve, to not be bullied by an organization that's supposed to help you. And I'm going to continue to do that until my dying breath, and until the guy upstairs says, okay, Joe, it's time. You don't do this anymore. But there isn't a person or organization out there that can tell me not to do this. So I'm going to keep doing it. I'm going to keep doing it because it is a serious issue. It has reached a critical point, and I can't just stand by and watch people I know going through what they're going through. All right, my friends, as always, if you're not a subscriber, it's free to subscribe to my channel. I provide free information. You can use some of it or not use any of it. It's up to you. If you don't believe some of the things that I say are correct, you're more than welcome to check with your lawyer or paralegal if you have one. Exercise due diligence or caution if you should do that. I have no issue with that. But at the end of the day, I know about the subject matter. I've been doing this for over 30 years. The WSIB has tried oftentimes to shut me up and get rid of me. It's never going to happen. They know that. Each time they do that, it just gives me more energy to keep doing what I'm doing because people need me. Please share my videos with others because there's a lot of people throughout this province who need help. They may be isolated. They may be in a position where they don't know how to ask for help, where to go and ask for help. They may be embarrassed about their situation. They can be secluded emotionally or socially. There are so many things that can go wrong. And if you can put them in touch so that they can feel that they're not alone, and they're not just going to hold hands with each other and be a support group. It's fine to have those, but where they need real answers to their issues. Share my videos. Share this channel. And if you want me to talk about a particular subject matter, send me an email. All my information is up here. All right. Friends, thanks for taking the time to watch this video. As always, it's a pleasure. And until the next time, take care.